We're Amy and Christina, two moms who learned the hard way that there's a lot we wish we knew about pregnancy and parenting.
So now we're asking experts all the questions, sharing what we've learned and what we're still figuring out, and keeping it real along the way. Welcome to What I Wish I Knew.
One thing about this podcast, Christina, is that we never shy away from uncomfortable or hard topics. Maybe it's the Scorpio in me, but I love it.
Yep, which is why we invited Dr. Sarah Oreck to come yap with us again. Intimacy after having a baby? Check. Talking to your partner about what turns you on? Check. And finally, how to make the most of that measly 6-week checkup after you birth an actual child into the world? Check.
I can't wait. So, without further ado, let the wild rumpus start. Welcome back, though.
Thank
So
you so
nice we had
much.
you twice. I was
Yes.
actually thinking about this tagline earlier today, and I was like, I feel like it should be advice so nice we needed it twice
Oh,
because
I
I
love
just
it.
loved the through.
I love that. That's brilliant.
Corny. Yeah. So welcome back. So this time, at the end of our last conversation, we touched a little bit about the 6-week postpartum milestone. And in that conversation, we bookmarked it basically and said, we should talk about this some more. And so here we are. And the very first question that we're going to start with is, who do we have to blame for the 6-week milestone that all of a sudden you show up to the doctor, freshly postpartum, some might say, and you leave the appointment basically being like given the okay to go back to your regular life. Good luck, Godspeed, enjoy. Why?
I know so I don't know exactly when it originated from, but what we know is that it's likely tracks with when the uterus returns back to its normal size and the cervix closes. But these things don't map onto how someone is feeling in the postpartum or any other symptoms around the postpartum. So what I would say is it's an old tradition that is sort of based on some physiological things that happen, but it doesn't map onto anyone's experience.
You know what's already wild, Sarah, is that you're saying that like your cervix is closed after 6 weeks. Has my cervix been open this entire time? Like I never even thought about that because it dilates and does it
Yes. I guess
undilate?
it takes a little while to get back to its original position and opening.
Whoa. I have never thought about it in my life, and I've had 2 children. Wow. Because wouldn't that be nice to also know? Again, there's so much we don't know about our own bodies. That would be so simple for someone to just tell us. I don't know. I guess it'd be nice to know that I wasn't still dilated. I don't know. I never thought about it.
Yeah, but listen, I think, everyone's body is different. This is probably based on some old averages. And what's most important is that it doesn't really track onto anything that they're looking at or thinking about.
Right.
And so that I think that's the crux of it. Like 6 weeks, it's like something we're stuck to and haven't. I mean, I think some OBGYNs, some midwives are reconsidering it. And I am seeing some people being seen a little bit earlier. But I think the 6-week myth around like somehow that's the time when you're mentally, emotionally, sexually kind of back to your baseline is just a complete myth.
I mean, I know my husband was extremely happy for that 6-week appointment. And I was like, you're out of your mind.
Yeah. It's like, where does that originate from? Where does that come from? But I do think our society in some ways, in addition to the medical establishment, has said 6 weeks is this important appointment. Even partners are like ready for it because somehow they think someone gets clearance for sex. You're the only person that can give clearance for sex, right? Like that's not something a physician can do or your birth worker should do for you. And so there's so much there as well. But
Well, I do think it's important to know, physically, I know you're not supposed to have sex for a period of time after a baby comes through your vagina,
I mean, it's also, right, that's also such a complex issue because I think what we're talking about is like penetrative sex and being ready for that. But I think that there's so much more to sex, which is really important. So I'm an advisor for natural cycles, and I love that if you don't know what it is, it's the only FDA cleared birth control app that exists. But most importantly, they have this thing called NC Postpartum, where you can put literally all your symptoms. So, in case your doctor still kind of subscribes to the 6 week visit, you can track like, do you have any pain? Do you have any bleeding? Do you have hemorrhoids? Do you have stretch marks, hair loss, all this stuff? Like you can track all of that. And it's really exciting to then be able to communicate that and share that data with your doctor. So if you're still in those dark ages where your doctor won't see you till 6 weeks, here's this really cool tool that you can use to kind of track all of your symptoms. Because sometimes when we show up, we like forget everything that happened in the last weeks, especially when you're taking care of a baby. So this can be like a really interesting way to kind of share, here's what I've been having, and literally like showing them, I've been having hair loss since this time, or this is when my bleeding stopped, or here's what happened with my stitches. You can also track your mood, which is really important. And I think that's one of the main issues I have with the 6 week appointment, because we know that mood symptoms can start to kind of come up way before then. And I think it's really important to emphasize the number one complication of childbirth are mental health issues.
Wow.
It's not preeclampsia, it's not your blood pressure, it's not your, it's not gestational diabetes, it's mental health issues. And so you are missing from delivery to 6 weeks this really important window. First, it's the baby blues, which happens in 85% of people. 2 weeks after delivery, that's sort of like the peak of when it happens. These tend to go away. It's like your mood is fluctuating between I'm so sad and weepy and like I'm so happy about what's happened in this baby. And then when you cross over into after 2 weeks is when you can start to see potentially postpartum depression and anxiety. And so my biggest worry with those 6 weeks is that no one's checking in on you. And so this is a tool so that what I was talking about with natural cycles, this is a tool where you can start to plug in, here's how I've been feeling, here are my symptoms, and you can show all of this data, which physicians love, by the way. Like who wouldn't want to see, oh, I've been depressed like 2 weeks out of the month. Like clearly something's happening here. Or I think it just gives more information. Or here's, I'm having hemorrhoids, like, for this long, or this is what's happening to my sleep or my hair loss. Again, there's so many physical symptoms to contend with. There's so many emotional symptoms to contend with. But often I think it's really hard in the postpartum to keep track of them, to then be able to communicate that to your healthcare provider. A lot gets lost. Anytime you go to an
I
appointment, you
mean,
kind of just forget all the things. I know
totally.
with like a pediatrician appointment, I'm like, actually, there was all these other things that the baby was going through. So I
Right.
think always writing it down. And again, this is a fantastic tool to also start to track like when your period does come back,
Mhm.
what that's like. Obviously, if you're breastfeeding, that can take a little bit longer, but sometimes people start to have a period when breastfeeding and can conceive. And this is like another myth that sometimes people don't entirely know about. So,
Ugh, and
yeah,
that's a biggie.
that's
I
a
mean, the
biggie.
implications of that are huge. So, well, if you think about it, Sarah, I was going to say, like, I mean, we obsess, or most parents, I feel like, obsessively track their babies,
Yes,
like bowel movements, pee, what
yes,
they're eating, how
yes,
much they eat,
yes.
when they're awake. They track everything. Yeah, Christina, like, still tracks it. Recently stopped tracking it.
Good for you.
But so but we do that because it's so much information and you're postpartum and you don't remember shit.
That's right.
Why would we not do that for ourselves too? It's just another thing we would have to remember is like, wait, how have I been feeling? Or like, I couldn't actually even tell you the details of like my cycle because I
I know.
didn't track it and
I
I
know.
don't, I
But
don't
but
know.
isn't
Like,
but isn't that interesting when then you're being faced with like, okay, so when am I ready to have sex? What's going on here? Like the hormones are just all over the place. What's really exciting is this can give you an understanding of like where your body is at. And I think that like bodily autonomy starts with also like having that knowledge. And for so long that knowledge has sort of been locked away. I think in sex ed, young girls think that they can get pregnant any time of the month. Like,
totally.
someone looks at you and you get pregnant. Like, there are so much misinformation. And I think tools like this, like natural cycles, can really help you kind of take control of that narrative, understand your body, and then share that with healthcare providers, which I just think would like supercharge healthcare. It's like, no, this is actually happening. Here's when I've tracked it, or here's what's happening.
Mhm.
Is really kind of nice. Again, when you have so much going on, and this makes it really easy, kind of in the way that people do track feedings or bowel movements in their babies. Like this is another thing to do. I also
Mhm.
love that there's this other element of this app, which is so brilliant, called NC Partner View, where your partner can actually see some of the symptoms and some of the things that are going on. So it's not all on you.
Oh,
It's like the
wow.
perfect antidote to like, am I ready for sex? Am I not? It's like, check out what's been happening with me. My nipples
Yeah.
are bleeding. I'm having this like no, right? Right? It's
Right.
like with that, and that also is really exciting because I think a lot of this ends up landing on the woman, even the tracking the bowel movements, like all of that stuff. And so to be able to have this like shared language around the postpartum, your fertility status, kind of like how your body is doing, is really, really helpful.
Especially if you're not comfortable or like you just don't want to be talking about it excessively. Like even if you have a great relationship with your partner, like maybe there just isn't an opportunity where you feel like comfortable, safe and excited to be like, so, I know I'm coming up on 6 weeks, but I'm still constipated and
Right.
my
And I have
nipples are
hemorrhoids.
bleeding
Like,
and I have
right.
hemorrhoids.
Exactly.
And
Exactly.
as you can see, the child is still waking up every 2 hours. And so, no, my darling, I don't really
Right.
want to get frisky tonight.
But I
Like,
think what's hard, so I think those expectations need to be set like earlier on. I think during pregnancy, like it's a great time to start talking about what is it going to look like? What is especially after the first one, because this is like so unknown. Here's what I've heard about intimacy and how it changes. And I think it's also a really great time for you as an individual to think of so many things change that you can get curious about your own sexuality, what you actually like, what you don't, and that may change in the postpartum. But having these conversations early, but I love like that there can be a shared aspect to some of the data. So yeah, I don't have to feel like I have to reject you, because if you were just like keeping kind of track of what's going on, you like,
right.
no one would expect you to want to have sex when you have like really painful hemorrhoids, for example.
Yeah,
It's like not.
totally.
So
Totally.
I think like even that, it just, I know it would make me feel like, oh, you're in it with me. You know
Mhm.
what's up. I don't have to like come from a place of rejecting you and explaining to you like why that's not possible.
When it comes to having conversations ahead of time of what it's going to look like after the baby, how to prepare, just like setting expectations, it's such a corporate term. Like let's
Yeah.
align on our
But it's
expectations here.
right. It's
But
right. You know,
but like
that's what the core of like relationship issues are, when you
yeah,
have misaligned expectations or the expectations aren't clear. And so I
right.
think there are so many ways to start this conversation. And yes, some of it may feel like a little doomsday, like it doesn't happen to everyone, but I think it's important to prepare, just in the same way that I love to prepare people for the possibility of a postpartum depression or anxiety or moods issue. Doesn't mean it's going to happen, but here are
Totally.
some ways to prepare.
Yep. So when we are talking about like if say someone's having a conversation with their partner while pregnant about what it's going to be like, let's just assume that this 6 week like milestone is in their head because it's something that like,
People talk
is
about. Yeah.
yeah,
Yeah.
people talk about it. It's
It's
a
in the
myth that's
culture. Yeah.
prevalent,
Yeah.
right? What is more realistic to say about like what it's going to be like? And let's just say at 6 weeks. And I know everyone's different, but it's like if we're saying that this 6 week may not apply as broadly and as specifically and as accurately as everyone thinks, what is more realistic to expect or to say that will happen?
Yeah, I think it's so varied, and I've heard of, there's some people who are ready when they have their clearance, and maybe they had an uncomplicated vaginal delivery or a very uncomplicated C-section somehow, and the bleeding has stopped and there's no symptoms, and even though they're let's say they're breastfeeding, which typically those hormones make it less likely for you to be that interested in sex and have less vaginal lubrication, for example. But let's say barring all of that, you're still feeling good about it. I think the thing to say is, if everything goes well, like, here's the upside. Here's this really good kind of scenario. But I would also say taking care of a baby, breastfeeding, like all of those things can have a huge burden. So physically, I may be ready, but emotionally, I may not be there. But here are the other things that kind of happen. I may have a C section, and that's a surgery that I need to heal from. So that may make things complicated. I may have vaginal tears. They may be insignificant or they may be quite significant. And so that's all going to make it very different, right? The vaginal tears are very important because obviously penetrative sex is going to be really difficult if that's not fully healed. And so I think there's just an element of, here are the physical things that can happen. Breastfeeding, I think a lot of people don't know that it's something that decreases your interest in sex, as well as, again, like I said, your vaginal lubrication. So that makes it so that might not be so interesting. Or you may have the burden of kind of being with that baby at all times. You may feel touched out. That's something else that can happen. So then what you can talk about is like, and I want to be, also you want an open dialogue about what each of your needs are. And if these needs aren't being met, if you used to have sex every week or every other week, like, what can you do? So I think this is where there's more of that conversations, like very openly about sex, which many couples don't have, of like, here are the things that we can do. Here's like what I'm interested in. Right? Can you masturbate? Like, there are ways to kind of have the open dialogue where I think everyone would benefit, frankly, from those open dialogues and their sexual relationships. But I think it's a time to get curious, to kind of maybe go to territories or talk about things that maybe you haven't before. But I think all of that kind of sets the expectations in a much more realistic place. That I think with this like very nebulous, at 6 weeks everything's back to normal, just isn't getting for people, and it's a huge source of conflict, frankly. If you are in therapy, I think it is a great place to start talking about this. Talk about kind of gaining and learning some sexual kind of language and curiosity. If that's sort of not available to you, I think I would start with reading a book. I really, really like Come As You Are. It's a fantastic book by Emily Nagoski. She's like a researcher in sex, and she does a great job at kind of explaining to us the ideas of sex that we have now, which are mostly based on men, and how those are so different for women. So, like, one thing that I love about that book, for example, is she explains that for most women, they don't have spontaneous desire. Spontaneous desire, it exists in about 85% of men. That means that you just see a naked body and you're immediately aroused and kind of ready to go. That's only 15% of women experience that. So the bulk of women have something that requires a lot more than that, right? Have desire that requires the brain. That is the things that are happening outside of the bedroom, the acts of kindness, the support, right? Are you helping me with baby? Is someone helping me overnight? Those are the things that drive sexual desire in a majority of women. And so I think that's like even a great place to start in kind of explaining to your partner, like, here's how it works for me. And even if I were ready with all of this mental load, I'm not going to be in the mood. I can guarantee that.
I just saw, it's so weird you just said that. I just saw an Instagram video that was exactly on that topic, and I found it intriguing. And it's this guy, I've seen his videos before. He basically like role plays both a man and a woman, and like it shows this like interaction. And he was talking about how like he was being the guy and being like, he like saw the girl walk into the room and was like, "You want to have sex?" And the girl was like, what?
No.
Like
Yeah.
I was just cooking dinner. Like, no, I'm not in the mood. But then later on, like, he does the dishes, he does what X, Y, and
Yes.
Z. And she kind of moseys up to him being like, so you ready now? And
Yeah.
he's like, well, of course I am. Yeah, sure.
And that's called responsive desire. Like you're responding to all of these other things that are happening, and that builds the desire over time. And so,
Yep.
like, what I tell people, especially if I see like a couple, is what's going to get her in the mood if physically things are okay, is like relieving some of the mental load. It's that
Mm-hmm.
easy.
Yeah.
Okay.
100%.
Like take on some of the tasks, and that will kind of get you there. Again, that's women are mostly responsive desire, men are mostly spontaneous desire. That's not true for everyone, to just be clear. A small
Mm-hmm.
percentage of men are also in that camp. So I just think a book like that starts to really unpack all of the misinformation we have about sex. And I
Mm-hmm.
think often because it's mapped onto that male sexual desire, women are told and are kind of gaslit into something must be wrong with me because I don't desire sex. I should just want sex no matter what, no matter what the context is. And I just think that that is so incorrect. And such a disservice for couples and for women, because I think women are then kind of told something's wrong with you, like you're not, what are you doing? Why don't you have like interest in sex? You're a nun, whatever it is. When it's actually like, well, I'm carrying all this load. No one is helping me out, so yeah, I'm not going to have a desire.
Yep. I remember, but going into my second birth, I remember like friend of mine, friendly, said something like, "Oh, well, don't let Andrew like stand by your feet, or like don't let Andrew be by your knees, like keep him up by your shoulders or something." And I was like, "Huh?"
Yes,
And it was like, "Oh,
yes.
he'll never see you the same." And I was like, "Girl, first of all, I've done this
Yeah,
before and he still loves me.
yeah.
Number two, what the hell? Like,
I know,
I'm
I know.
sorry, is my giving birth to our
Yeah.
child something that
Yes.
might turn off my husband?
Yeah, yeah.
Never ever would I think about that. And also, like, shame on you for
Yeah.
thinking that. Come
That's
on."
absolutely the case. I'll branch out and have some empathy for this friend. I think we are told in some ways by our culture. Like, I don't think it's necessarily your friend's fault. I think it's more the patriarchy that somehow once you become a mother, once those things change, you're less desirable. I think this all has to do with ageism, youthfulness, the obsession with like the young girl versus kind of that woman that is more mature. So, I don't think it's totally her, but I think it's really important for you to have those conversations, for you to kind of challenge her of like, really, that's not the case for me. Like, this is what happened here. Um,
Yeah.
it's yeah.
I think I did say that back. I think I
Good
got a
for you.
little sassy. I think I
Good
said
for
something
you.
like, I think I actually did say, like, well, I've already had one and like we've had sex since then. So I don't know. I guess he
I
still loves
mean
me.
that
Like,
yeah, that's on
come on.
I mean that's on men to resolve for themselves.
Yeah. Like 100%.
Yeah.
One of the other questions I have around that 6 week. So I think I had actually said in our last conversation, I talked a little bit about my own 6 week checkup, which was that I literally rolled into the doctor. They asked me what birth control I wanted to be on. I told them, they took care of it. And then I left the office.
I mean, it's really so wild. Like, I
It
think
was.
certain states mandate that it's asked during pregnancy and postpartum. I don't think North Carolina is one of them, which might be part of it. I think there's a couple things going on there. So one, knowing that mental health issues are the number one complication of childbirth, I agree with you that is, it seems like such common sense that is the first thing that you would ask, even just from like being a human being, right? Like you
Right.
just had this huge experience, your life has changed, your family has changed. How are you?
How are you?
Right, exactly. But I think the other part that's sort of like the darker part of this is that often I am finding that practitioners don't ask because they don't have answers. They don't have practices to refer you to. They don't want to have the session kind of go on and on because they have 20 more patients to see that day. And this is the sad reality of like insurance-based OBGYN and midwifery practices, that they have to see a huge, large volume. I mean, I could
Right.
go on for days. This is
Do they get
why.
paid? Do they get paid like per patient, right? So like the
Yes.
more patients you see, the more money you're going to
Exactly,
make.
exactly, exactly. And, but I think the other side of that is reimbursement from insurance companies for OB providers in particular has decreased over the years significantly. And so they get paid more
For what
on,
reason?
because we have
Oh,
such great maternal health outcomes. And so this is the same kind of, this is part of the same equation of like when we are thinking about, and this government administration is thinking about cutting Medicare and Medicaid, that is going to directly impact mothers. And even if you think, oh, I have commercial insurance, that doesn't touch me. Every academic institution, every insurance company has lines of service that care for Medicaid and Medicare and get a huge sum of money from that. So as we see cuts to that, it's going to erode both our insurance providers, but also our hospital providers, our healthcare workers. And so the reason they're seeing so many patients isn't because they're greedy. They could not keep their doors open if they
right,
didn't. And
right,
so it's this like, right, but if you are really depressed, they're going to have to kind of figure out how to hold you, how to figure out, like, talk to you longer. But it's this really sad reality that sometimes it's like, well, if I don't ask, maybe I won't have to deal with that, and I have no one to refer them to. And this is where I was really passionate about Mavita Health and founding this company, because as someone who was doing this in private practice, my waits were long. I was expensive. This care really needs to be available and accessible to everyone across the US. And so that was really one of my goals, but it was mainly because I had seen so often that OB providers and midwives had no one to send their patients to when they were struggling.
right. Well, so I didn't get asked about my experience at my 6 week, but I do have a check. There was like a little checklist that I would fill out at the pediatrician, which was
Yes,
like three
yes,
questions.
yes, yes,
But
yes.
then my question, which is like, have you? I don't even remember what they are, but they're basically like a depression screening.
Screening,
But
yes.
then my question is, so what if I had marked yes on one of those? Is the pediatrician's probably even less equipped than an
I know,
OB to
I know.
do what happens next? And
That's right.
also, I'd
So,
like to see the data on who actually replies to that screening and is like,
yes.
yes, I've been feeling
Well,
suicide. I've had
there's
suicidal
so
thoughts.
many,
Like,
yeah, there's so many things here. So pediatricians in some of these states, and again, by all of the kind of big academic, big organizations like American Academy of Pediatrics, et cetera, they are supposed to be screening in the postpartum because they see you most often. They're seeing you for those, every 2 weeks when the baby's initially really young, and then every month. So they're a huge like potential point of intervention. But what I find is people are very afraid of saying something, because then does that mean that CPS gets involved, Child Protective
right,
Services? Does that mean that like I get
right.
into problems for saying something like this?
Because
And
it's
then
in the context of caring for your
yes,
kid that they're
yes.
asking you this.
And so ultimately, I think that point of potential point of referral tends to fall flat. Though I think some people are pretty honest, or you can see as a physician very clearly, mom is really struggling, or they're coming in every day with a new complaint. Like I'm a little bit concerned about this, but similarly, they're having a hard time referring the patients out, especially because it's not even their patient. And so I think one of the huge things I identified in all of this is that I think sometimes um, people and physicians and clinicians aren't kind of doing their best in terms of asking these questions and investigating really, because they don't have the way to refer the person to care. And all of the like your OB, your midwife, they know that that therapy is the best treatment for mild to moderate depression and anxiety, not just an SSRI. But often the SSRI, that's the selective serotonin reuptake inhibitors that are very commonly used for depression and anxiety, are the first thing that they use because they don't have anyone to refer you to. especially if you need in-network care, especially if you need timely care.
Mhm.
So that is really something that I think is worth revolutionizing and really trying to push back on, is like, can we get, and this is what Mavita Health does, we get you into the individual therapy, into group therapy if you want, before we consider the medication. Now, if your symptoms are already severe, if you're having thoughts of not wanting to be alive, if you're not functioning, it may be indicated to do therapy and medication. So I think we need more mental health care accessible to all, because we know that that is a point of intervention that not just helps mom, but it helps baby and her family. I am convinced, and actually, this is important to talk about. So, if you have untreated mental health issues during pregnancy, you have a higher risk of C section. You have a higher risk of preterm delivery. You have a higher risk of your baby being small for their gestational size. You have a higher risk of your baby going to the NICU. Then we'll talk about the postpartum. You have less likelihood being attached to your baby. And attachment in that young, kind of in those first years of life, is so integral that I think it has impacts later on. Why are we seeing so many kids need child, adolescent psychiatrists and therapists? I think it's because some of this is kind of problematic in the beginning. Uptake of vaccines is associated, so people who are more depressed in the postpartum are less likely to have their kids vaccinated. They're more likely to go to the ER more frequently. And so all of this, I think, is just a little bit of like, to give you some of the evidence for the fact that I think the mental health services of moms needs to be so much more robust. I also think once you have those mental health services, if mom thrives, guess what? She'll be able to go back to work faster, if that's something our capitalist economy is worried about. But I also think, in addition to that, the systemic changes need to happen. So we need paid federal leave. We need more affordable childcare. And I think those are interventions that will actually make America healthy again. Not trying to
Yep.
take down vaccines, not trying to get rid of food dye. I promise you, no one has died of food dye, but what they have died of is mental health issues in the postpartum. So the number one killer of women during pregnancy and postpartum is suicide and overdose.
Oh my god. I didn't know that. That's so sad. That's
Yep.
so sad.
But instead, we're
I'm
distracting mothers with all of this other talk about the horrors of unprocessed food. Sure, I wish everyone could have more access to healthy, like fruits and vegetables. Of course, that's the case. But when you cut SNAP benefits, that's money that aids underprivileged families to get access to food. That's not going to happen, right? Like, so
yeah.
I think we're just really off on our priorities right now, and I think there's going to be really detrimental effects to our maternal health outcomes. But I'm also, as a mother, so devastated that I think it's going to have outcomes on like how long our children live.
Yeah. Oh, I think it's really sad to think about. And I also think it's reflective of how our culture has become like everything is pure clickbait. Everything is short term. So it's like
Yes.
flashier to be like, get rid of the food dye than it
Yeah.
is to
Yeah.
have like a
Or the
deep,
seed oils. I
meaningful,
mean,
the
the
seed
seed
oils.
oils for me
Right.
are like,
Right.
that is.
Because the thing is, like, you're asking people to use their brains for more than 10 seconds and they're
Yeah.
gone.
Yeah.
Like, and I'm talking about myself as a consumer too, but
Yeah.
it's like
Yeah.
because of social media or because of how information is ingested these days, it's so much easier for someone to just look at a headline and then walk away and repeat that headline to someone else without
Yes.
any of the context. And I mean, all of these other issues you were talking about around sort of like the ripple effect of if you elevate and prioritize women's health, like what happens? Maybe
Oh,
that's
your
not
whole
like a
society
sexy
gets
headline.
healthier. Yeah, but your whole
Right, but you have
society
to
gets
think about
healthier.
that. My
Yes,
point is
that's
like you
exactly
you
right.
can't just if
And
I
it's
were to
long,
just
and it's
say
long term.
and
And
it's
it's
long
long
term.
term. Yes.
Exactly. It's something that you have to think about for more than 10 seconds
Right.
to like get behind potentially. And so
It's an
or to
investment.
understand.
It's not a get rich quick, which is I think
Right.
the solutions we are, that they're proposing. I think we're in a really vulnerable space where we're overwhelmed by everything that's going on, by our mental health issues. And I think in some ways it's a very kind of open and ready kind of population to take in some of this misinformation, sadly.
Mhm. Ugh, also, is it that we're so busy we can't find the time, energy, or heart to fight back? Like,
Maybe. Yeah.
it's you've talked about this a little bit on your channels of it's so easy to wanna just put your head in the sand and be
Oh,
like, "I'm
yeah.
not watching the news. I'm
Oh,
not doing
yeah.
this. Like, I'm
Yeah.
protecting my these are my boundaries. I can't, I'm not
Yes.
following this account. I'm not doing that." And it's conflicting because I see how much better that might make someone feel sometimes. And also,
Momentarily. Yeah.
but if everyone's doing that, then who's fighting?
Yeah. I mean, I
Who's
think that's right. And I think it's about like, don't disconnect altogether because that is just, it's privileged. And guess what? It's coming for you. I don't want to fear monger, but I do think we've got to wake up to the realities. And I think, if anything, think about your values, what's important to you, and how and in what kind of world you want to raise your children in. If that
Mhm.
doesn't get you sort of going, I mean, I'm not sure what will, but I think that is enough to kind of explore, hey, can I do this in a boundaried way? I don't have to be on social media all the time. I don't have to be listening to these channels and kind of these images that traumatize me, but can I read news once a day for 15 minutes, understand what's happening, and then figure out really small ways that I can contribute, that I can make a change? But I think there's also an element of news of like, it doesn't have to be so emotionally charged. What we call it in sort of psychiatric terms is affect laden. Like CNN and Fox News is full of people with a lot of emotion because they're trying to
Mhm.
get you hooked to watching a television show. It's like a reality TV show. I mean, they're saying things that are true, but it's a lot of like opinions. And I think when you can get to things that are delivered either in print, which doesn't have all of that emotional aspect to it, or even I like to use, but NPR as a great example of like monotone voices. We are
Mhm.
just reporting the news. Here's what happened. Da 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 da. Is
Yep.
different than the impassioned kind of pleas that happen, which can kind of affect you more. As well as like I found, and I'm a Latina living in Los Angeles, so this was very impactful for me on a personal level. But like I felt overwhelmed by the number of videos, for example, around the ICE raids, the mothers being literally separated from their children, children being bound by their hands. Like it was a lot. I am in some ways I thought that I needed to see it, but at some point I needed to like turn it off a little bit. I don't need to be re-traumatized every single hour.
Right. Right. And I think your point around like the emotional element that applies even for news outlets that like say you are a Democrat or you're a Republican and you want to get your news from a Republican source or like even if you're looking at someone who's saying something from your
Oh
point of
yeah.
view, that
Yeah.
emotion is still
Yeah.
going to like spike
Yeah.
you
Oh, 100%.
of just feeling bad about it.
100%. And I think for me that's when it's important for people to start to check in more on your morals and values and forget the party. Who's aligning
Mhm.
with what is important to you, how you see this
Mhm.
country going? So, holding on to those labels, does that make sense for you anymore as an individual, as like, a living, breathing person in the US who potentially has children that they want to see grow up maybe something close to what they had or better?
Right. Yep. Well,
On that note,
on that note, I do want to ask one more question, which is going back to the postpartum experience and how we treat women and what support they should be getting and aren't. And in the name of, let's just say, realistic progress, incremental
yes,
progress,
yes.
knowing we're working within this 6-week milestone,
Yep.
in an ideal world, what would you recommend a woman go to that appointment asking about, wanting to talk about,
Well, I think the first thing that they can do is when they get that appointment for 6 weeks, say, hey, can I get one earlier?
Hmm,
Doesn't
I
hurt to
like it.
ask. Doesn't hurt to
Yeah.
ask. They may say no, that's not what happens here. Like this is what we offer. But I think asking and unfortunately, a lot of what I'm going to tell you is the advice is women advocating and mothers advocating for themselves, when I think, right, like this should be more systemic and
Right.
widespread changes where they don't have to do that. But I think this is an example where this is how the system is. So can you advocate for something different for yourself? That's one. Two is, it's so hard to like write things down on paper. If you have access to something like natural cycles, which is covered by insurance, which is really exciting, and you want to get to know more about what's happening with your body, track a little bit of like some of your symptoms, there's actually a way to download that data and then share it with your doctor, which is fantastic. You can show them,
Mhm.
here's what's happening with me. But I would love for people to have all of their information of what's happened, what's transpired in the last 6 weeks, and jam pack it to that appointment. So, for
Yeah.
example, when you had your experience, and to be like, oh, and what should I be doing about my mental health? What's normal? What isn't? What should I be experiencing? And again, unfortunately, this puts a lot of the burden on the mother and the parent, but try to share it with your partner so they can go with you and ask the questions if you're a little bit tired or if you're not feeling it. So I think it's, unfortunately, we're at a place where we have to do a lot of information gathering ourselves and then bring it to our healthcare providers. I do have to say, for the most part, healthcare providers, I certainly am talking for physicians, most clinicians are well intentioned. They're not there to make your life worse. They're not there to, I know there's this thought that like OBGYNs just want to, go and give you a C-section. That's absolutely not the case for most clinicians. And so if they're well intentioned, understand that like the system is also very hard. And most clinicians, if you bring things up, in a kind way, will be receptive to it because they want you to feel good and have good health, and they're worried about the health of you and your baby. So I'm also really tired of the demonizing of your pediatrician, for example, for recommending vaccines. We do not get kickbacks on vaccines. Vaccines are dirt cheap because they've been around for so long. That whole concept to me is so silly. But what we do know is public health works. Why don't you hear about polio? Why don't you hear about measles and mumps? Well, now you do.
Yeah.
Is because we've almost eradicated them. This is incredible progress. So I don't know how we got here, but your pediatrician and your OB are not the enemy. And
Yeah.
I don't know, that's
Yeah.
just something.
And advocate for yourself and
And
continue
advocate for
advocating for
yourself.
yourself until the
Exactly.
system allows anyone else to advocate for you.
Exactly. That's right.
It's so necessary. And Sarah, like, thank you so much for what you've been posting on Mavita Health and your own account about, like Amy, just to retap that, like about staying sane right now and trying to do the most that you can, because it's a lot of feelings at once. I'm a military spouse. I'm the daughter of immigrants. I'm a dual citizen myself. Am I next?
Yes.
So like
Yes.
I feel a lot of things at the same time.
Yeah. I think it's also really important to experience joy. And joy is resistance. And I think that is also really important. You can hold these two things at once and this tension at once and still experience the joys of, how cute Olivia is playing with your microphone and like all of these things. And I think some people are starting to feel guilty of like, can I go to the gym? Can I get my hair done? It's like, of course you can. Of course you can.
Yeah.
And you can have a heavy heart and think about all these other things and think about what role you can play. Especially and the people that bury their head in the sand, I imagine it's also because you like the way your life is. So if you like the way your life is generally, you have something to fight for.
Yep. That's so true.
1,000%. What is bringing you joy lately, Sarah?
My kids always, like, I'm so fortunate in this moment, in my opinion, to have young kids who are like not at all in the realm of needing to hear about this, understand this at all. And that gets me really present, like in their play and in their innocence and in the joys of my 15-month-old starting to like have some words and just like seeing her personality. I think that is bringing me the most joy, though I also kind of feel for being like this empathic therapist that I am, like people with slightly older children who may be hearing about this at school, or adolescents who may be scrolling social media themselves, really complicated. I think there's a lot of ways to talk about things, but please talk to your children if they are older and seeing some of these headlines, because I think that's really important. But I'm going to take this win that my kids are still too young to ask the questions or be involved in this, because it's been really helpful for me.
Yeah. I want to end just because Christina, I didn't get a chance to tell you the story, but if you'd like a little joy in your life, and this does have expletives, by the way, this morning I was sitting at the breakfast table and my almost 5-year-old, 4.5-year-old goes, "Mommy, is fucking idiot a curse word?" And I said, I like looked down. I was like, don't smile, don't smile. "Yes, sweetie, it is." And I didn't say anything else. And he goes, "So when Daddy said, 'fucking idiot cat,' that was a curse word?" I was like, we have a cat. Andrew would say, I have a cat. He hates cats, obviously. And I said, "Yep, sure was, sweetie. That was a curse word when Daddy said it too. Mm-hmm. Yep."
Oh my God. That's
And
so
I had to
funny.
go back to Andrew and say, "Andrew, buddy, he can hear you. Please don't use that phrase."
Oh my God, that's a great one. That's a great one. I also have to say the Dallas Cowboy cheerleaders are back on Netflix.
Oh, I heard they got a 400% raise.
Oh my God, that brings me joy.
400%.
That brings me joy. What?
That they deserve it.
They deserve it.
Landing on their split.
Deserve it. What screams woman more than I had a pulmonary embolism, was in the hospital, and a month later I knew I had to try out and did it.
Damn straight she did.
Damn
straight she did. She's going to get paid more.
Right. And I'm just like, this is womanhood here.
Sarah, thank you so much for talking with us again. Our first guest ever to come back twice. So we knew it had to be you. I'm
feel
glad
very
it was
special.
you.
Thank you so much.
You are special. And we'll continue elevating your message. We love it. We love talking to you and just can't thank you enough.
Thank you for all your support and your kind words. I really appreciate you guys.
If you found something helpful, insightful, or just plain reassuring in this episode, be sure to subscribe so you don't miss the next one. And if you have a moment, leaving a quick review helps more parents find us.
We're also always looking for great guests. So if you know someone or that someone is you, please reach out. You can find us at whatiwishiknew_ or whatiwishiknew.life.
Thanks for listening. And until next time, stay sane, stay calm, or at least fake it until bedtime.